Most people want to remain in their home with their family and familiar surroundings for as long as possible. One way to help make this possible is through accessing home support. Personal support workers, commonly referred to as PSWs, are trained care professionals who provide a range of supports to a care recipient, from bathing, dressing, and toileting assistance to accompaniment on outings or light housekeeping and meal preparation. PSWs are an integral part of our community and healthcare system. There are different ways to access PSWs. Let's start with exploring home and community care support services, previously known as CCAC and then LIN. They are responsible for assessing needs, determining eligibility for people to receive government OHIP-funded support from, like PSWs, nurses, and occupational therapists, as well as access to long-term care homes in Ontario. We will take a closer look at long-term care homes and that application process in our Right Place of Care video. HCCSS provides OHIP, or government-funded PSWs, that can assist a person with personal care tasks such as bathing, toileting, dressing, feeding, and medication reminders. This is a free service covered by OHIP and is intended for persons with high needs. It is important to note that the care provided is limited and task-oriented. The Home and Community Care Support Services eligibility criteria for PSWs is based on a person's need for support with personal care tasks they are not able to do independently. This service does not assist with housekeeping. The HCCSS is divided into geographic catchments, with the Toronto Central Catchment covering East York. For folks located east of the map border, they reside in the Central East HCCSS catchment. To be assessed for eligibility for OHIP-covered PSW support in East Toronto, call the Toronto Central Home and Community Care Support Services at 416-506-9888. When calling, the care recipient should be present so they can provide verbal consent for you to speak about their care to the HCCSS representative, and you will need to have their OHIP card number ready to provide to the representative. Please note, eligibility for PSW support is usually based on the need for personal care help. That means that to qualify, the care recipient likely will require help with toileting, dressing, or bathing. If the person is independent in these areas or unwilling to have a PSW help them, they will probably not qualify for HCCSS PSW hours. The HCCSS phone representative will do an initial eligibility screening and decide if a care coordinator should be assigned to do an in-home or phone assessment for the care recipient. If the HCCSS representative you speak to does not find the care recipient to be eligible, you can always call back and speak to someone else. Or if there is a change in the care needs of your care recipient, you can call back and inquire about OHIP-covered PSW support at that time. You can also talk to your family doctor, as they can make a direct referral for supports to home and community care support services, and also may be able to advocate to your local HCCSS on your behalf. To help navigate these and similar caregiver resources, visit the East Toronto Health Patrners Service Directory. The link can be found in the description box below this video. For more information on navigating the healthcare system for your care recipient, watch our other navigation guide videos.